Recording is active. Awesome. All right, everybody. We got one of my favorites, Dr. Matt. Oh, Matt, we've got a long story. And I think like just how you and I have been talking just before we got on this thing is, I think when I think about you and what I would like to accomplish today is think about, challenge people on like the status quo. And I think the reason I say that is like from the day that you and I met, I flew to Portland and you had probably like 2 offices back then. The one that
Yeah, I think one in a baby practice at that time. One I just started.
Yeah, and I think you were married, but you didn't have kids back then. You had like same long like crazy hair, crazy looks. I don't know if you were hunting back then or not, but I remember walking into the practice, everybody was cheering and smiling, and then you're like, all right, let's go and have something to eat, right? So we stroll through the streets, we get a bite, and then you're like, let's go and check out my house. And I'm like, wow, this is awesome. This is going to be really cool. I really hope to tell that story one day. And then we go to your house. Oh, no. Before we get to your house, I think you had 2 practices where you were building the second, because I remember it's stuck in my head that you're like, let's go. And then we go, and I'm like, we go through some street and I'm trying to look for the nice cars, right? And I'm like, you old dentists drive nice cars, right? Not judging anybody. And then we go and I'm like, wait a minute, there's this old van standing here. And then you're like, let me clean this up a bit. So we go inside your van, you take some stuff from the front seat, throw in the back, and you're like, dude, this thing is so cool when you go fishing. And I'm like, wow, this is going to be awesome. So that's how you and I met.
Oh man, I love that. Yeah, I remember that day. I was excited for you to come out. It meant a lot to me for you to come out and visit.
It was awesome. So like, what's your, like, how did you start? Like, why dentistry? And then why do you think you're slightly different?
Yeah, I've always been a little bit different, I think, but I think everybody is. At some point, I just embraced, who I was and what I believed in. And it's funny you bring up the cars because I don't think that having an expensive car is something that is of tremendous value to me. Now, I don't fault somebody that does. I mean, some people that's their passion, and I have other things that I love. But I love my van because it gets me around, and it allowed me to build all the cabinetry in my first practice. It was a tool that I could move cabinetry around. I built the front desk. I did a lot of work myself in the very beginning because I had to. I had to hustle. So. So back to how I started, I didn't always plan on being a dentist. I wasn't a kid who said, I really, really want to work on people's teeth, or I didn't have some crazy experience. When I was younger, I wanted to teach, and I wanted to help people. I wanted to become a professor. I loved being outside, and I wanted to become a college professor. In my senior year of college, one of my professors and my greatest mentor said to me, Matt, do you want to do this? And I was like, of course I do. I want to be just like you. And she said, well, if you become a professor, it's going to take a long time. You're going to invest a lot of energy, and you're not going to make very much money, and you're not going to get to choose where you want to live. What about becoming a dentist? And I said, well, I had never really thought about that. I'm in my senior year. I'm kind of ready to party and have an easy semester, and I know what that would entail. And she's like, you should do this. So I just took a leap of faith. My senior year, my second semester of my senior year, I took anatomy, physiology, microbiology, and took all those hard classes, did well, and then had to figure out, where my life was going to go. And I decided that dentistry might be a path I was going to take, and I was going to try it out for a bit. So I took after I graduated, I did really well that last semester. I really buckled down, did the best I did all of college, and took some time to study for the DAT. Did well, then left, moved from Oregon. I moved to Utah to ski patrol because I knew that's where the good snow was. And I interviewed at every single school I applied to, and except for the one that didn't make me interview because I didn't have any money at the time. So I didn't interview at Creighton where I ended up going because they didn't make me. And I wanted to save the money, so I had enough money for beer and food while I was ski patrolling. And that ended up being the school that I went to, just because I had a mentor that said, hey, if you want to have the skills, you need to go to a school that doesn't have any specialty. So that's my story of how I got into dentistry. I was planning on being a dentist just for basically for the lifestyle initially. And then I fell in love with the dentistry, the industry, the people. And that's how I'm where I am today. Short form.
And how long did you work as an associate?
I worked as an associate for my first job, was in Omaha, Nebraska. And I worked as an associate for 2 years there, at a Medicaid clinic. Built up my speed, got really good at managing my time. And then I went and moved back to Oregon and worked for Aspen Dental, built more speed, had a crazy experience there, got really good at surgical extractions, dentures, and had, increased my clinical toolbox that way. Then I left Aspen Dental. I worked there for about a year and a half. Then I worked for a private practice while I was building my first practice. I used to work 7 to 7, 3 days a week at that practice. And then 3 days a week, I would work at another practice that I had to drive an hour to go to. And I worked there. So I was working like all the time. I had a wife that was a dentist too. So she knew what we were trying to build. I didn't have kids. And, I just hustled as we were building that. Like I said, I built all the cabinetry from IKEA and just hustled like
Yeah.
you do. I think that's why I identify so well with you, because, if you just dig in, you can do it. Now, fortunately, I'm in a position where I don't have to do some of those things. That I didn't.
Can you rate yourself as an associate? Like now knowing what you know, like how good of an associate you are on a scale of 0 to 10?
It really depends where I was at. I'm not the associate. I'm not the associate that I'm looking for. I can guarantee you that. I have in my practice, I have 2 associates that I'm looking for. And I would say I am one. I'm looking for an entrepreneurial associate that wants to grow and build practices with me, that wants to be on my team and has that entrepreneurial spirit and really wants to take the risk and make the investment, work the long hours and do it. I'm definitely looking for that associate. And I have that in some of my associates. I have other associates that, it's not easy to work in my practices. And we're really upfront with that. We're really customer service oriented. We expect high levels of clinical excellence. It's not easy. You're not going to come punch the clock. I expect you to manage the team and things, which is really rewarding. But I have doctors that just don't want to take the risk. They don't want to throw down money to invest in the group. They want a steady income. They want to learn from us, and we provide that vessel for their growth. If they're a young doctor, they're not really ready to, take out a big loan. They have a lot of loans already. There's a place for us, but we're also looking for that really entrepreneurial hustle that wants to start and build our organization too. But for me, I was not the first one. If somebody said to me, Matt, you can own part of this group and you can grow, and I'm going to show you how to do it, and I'm going to mentor you, that's what I was craving. That's what I was looking for. And so hopefully that's what I'm building for people. I always think about what was past Matt like, and what would he want in this situation? And most of the time, I wanted mentorship. I wanted somebody to pat me on the back, say it was okay. I never got that. What I got was absentee practice owners that made me feel like I was just making them money. So yeah, that was unfulfilling for me. So that's what drove me to build the first practice.
You know, it's so crazy. I have similar thoughts too, a lot. Like when I think about me working at a 1.5 jobs that I had, it's like, and I still do actually have that, is like sometimes you are looking for someone to be like, oh, you got it. Like without a shit sandwich, part of my language, right? Like this is where you messed up. This is where you can do better. This is great. Like, but you got to push in this direction. And it's funny, like, and I remember graduating from college, I already had my first business going. I really wanted to go and get a job, but I was afraid that to get a job, believe it or not, like I was more comfortable having my own business instead of getting a job because I was afraid having a bad manager who would not be like what you were explaining, like what you were telling. And so I ended up staying at my own business.
Yeah, that's true. Managing people is hard, and it takes incredible skill. And in order to manage people, you have to already be fulfilled and satisfied in yourself to have your bucket full enough to help somebody else. And you're not trying to get more just out of the person. You're trying to help that person get more out of themselves. And that's an incredibly hard thing to do and learn, something that I'm still learning. And I know I just never had that in any of my associateship jobs. There wasn't somebody there that was there to help Matt grow and learn.
It's interesting. Do you think you're ever going to get to that level of like, I got this, or it's always going to be a work in progress?
Oh, I hope not. I'll be dead if I got this, Tiger. No, it's
so
always
90 plus to go.
Yeah, I'm always learning. Yeah, and like you, hopefully we'll be better tomorrow than we were today.
Yeah. Matt, how did you learn to be a good communicator? Because I always known you for like communicating really well when you hired a CEO or the guy who helped you or took over. I don't know the whole entire story, but I remember there was a transition or someone that took over the business side for you. And then I remember even when you were part of Zen and then you guys didn't like it and you were leaving, just the way you communicated, how you communicated with your own team, like where did it all start?
That's a good question. All we are as humans is communicators, and I'm always trying to get better at communicating. And that's really what makes us different. And I think the key to communication is getting what you're feeling on the outside. And if you're frustrated with somebody, you owe somebody, or frustrated with something, you owe somebody to explain what's happening and what's showing up for you. And as I try and help others and help myself, I just think about what is it that's happening on the inside that I'm not getting on the outside. And I think that for me, that's the key to communication.
And how do you start the process?
I think the process has started with self-awareness. I think for a lot of people, including myself, it starts with a good therapist. Just getting to know yourself. You can't help others until you get to know yourself, and that's a lifelong process that never ends because we're all changing.
So let me hit the nail on the head. Like, do you think dentists, dental assistants, we're all humans, right? Besides professionally at the office, I really don't like to differentiate when we talk about the teams. Everybody has the role within the team, but everybody's a human being, right? With the same set of problems. We all deal with different maybe kinds of problems, but we all deal with problems. And so I think the knowing yourself, it's like one of the big things. And do you think like even to you feel like you have a lot of self-confidence? You know, like you're okay going to a dental conference with just like a jeans and a shirt, like without wearing a suit, you know, like, and you're comfortable. You can tell some people do things, but you can tell they're not comfortable doing them. But you're like, I'm driving my van, and I'm good. And I wouldn't be surprised if you're still driving that van, like I love that.
I do still drive the van. I have another car too, but I drive the van most of the time. Same
Right.
van.
And so,
Same van.
and how many offices you own now?
4.
So, yeah, and I've seen people driving different cars with one office. But the point is, like, again, we're not judging. Like, you're just comfortable. Like, where that is coming from.
Well, I think that isn't something that has always been. And I think that's really important.
You weren't like that always.
No, I was not like that always. I spent most of my life trying to fit in. And then at one point, and there wasn't a turning point. Great stories have a great turning point, but unfortunately this one doesn't. It's like life. There's a lot more gray than black and white. So, and I'm still working on that. I'm still trying to be, more of who I am. But at some point I realized that a lot of that trying to be somebody that I wasn't didn't matter. I spent a lot of my time trying to be a chameleon. At one point in dentistry, I act a certain way, and I have a certain way that I dress or the way that I am. When I'm skiing, I hang out with this crew and I wear these things, If I switch from a straight brim hat to a curved hat or whatever that is, depending on who, and at some point just realized that there's more to life and I needed to streamline things, and it was easier if I just focused on what worked for me. And once I learned that, particularly in business and with my practices, if I built a practice that was for me, it was going to be more successful. Because there was a time where I was trying to figure out what's the easy thing, what's the next, I need to be an implant practice, or I need to be a fee-for-service practice, or I need to be X, Y, and Z after I listened to the last webinar and I was going to go halfway into it. And then at some point I realized that I'm just going to build a practice that I would want to go to, one that I would be comfortable with, one that fits my needs. And as my business has grown, I really focused on what are my needs, because that's going to help other people live their best life too. Because if I focus on my needs, I'm going to be able to have more energy to focus on their needs and help them focus on what they need and what they want to achieve.
Mm-hmm. Mm-hmm. Yeah, it's interesting. And that gives you confidence, right?
That's the root of confidence, is knowing and loving yourself. And then it's funny, that's one of our core values, is know and love our people. And so we created these core values for their business, but they're really core values for my and my family's life.
Really? What are they?
Do that. So know and love our people, good vibes and high fives, to joyify the journey, and to rise by lifting others. So that's just what we believe is important in life. And then we talk about that all the time in our business to help us have like a North Star of who we want to be. And then the business follows.
Mm-hmm. It seems like an interesting approach to start with your personal life, figuring it out, and then building the business needs around it. Because I know some people approach it differently, and depending on the businesses, or maybe the views, or it might be anything. But have you seen, like, as far as like dentistry, that those that did it from family then to the business were more successful? And I mean, we can obviously define the word successful too, but in just the common happiness level of the word success.
Yeah, that's a really good question. In my own experience, as I started on this journey, it was really binary. I would have work and then I'd have my life. And it didn't, there was what I thought work-life balance was work-life separation. And I've come to learn that doesn't really work for me. So as I was interviewing for dental schools, ski patrolling, I was like, I'm going to have dentistry fuel what I do on my outside life. So I'm going to hopefully work 3 days a week as a dentist, and then I'll ski patrol, or I'll ski, or I'll do whatever hobby enthusiast activity that I love, and that's what I'll do, and I'll keep those separate. Well,
you're like Enzo Ferrari.
Yeah, right. It's really challenging to have two separate lives, two alternate egos that are pulling. At some point, I just decided that I was going to mesh those two things, into one. As
like ski in a doctor's coat.
Skiing in a doctor's coat. Well, it eventually meant to me that I needed to move out of dentistry, clinical dentistry, and move into leadership, and that was probably the cornerstone in my development as a person, father, a business leader. That was the most challenging thing for me, because that was being a clinical dentist was my identity. And people that moved out from doing clinical dentistry as I was a clinical dentist, I lost respect for them because I thought they were disconnected from the dentistry and what I was doing. So that was an incredible challenge for me to move away and make that decision.
How many years after you started your first practice you moved out of the clinical?
I moved out of the clinical 5 years after starting the practice. Started to transition about 4.5 years after starting the practice, and moved out completely. Timber Dental is a little over 6 years old, about 6.5 years old. April 2014 was when we started the first practice. So, not a huge history there.
Mm-hmm. Wow. What steps did you take to move out of the clinical? And more like, yes, you can hire doctors and all of that, but I can imagine how difficult it is. Like, because probably as a dentist, you have a structured day, right? You go in 6 o'clock, 6:30, you have a first patient at 7:15, right? You do the morning huddle, and then boom, the day is over, because you run from operatory to operatory, quick bite, come back, talk to your assistants, come back, boom, done, out the door. Now you move out of clinical, you're in a leadership position, you look at your schedule and you're like, it's empty. Probably in the beginning, right? As you're trying to figure out what to do, and then the meetings. So what was it for you, or how was it for you?
Yeah. So let me go way back to when it all started when I hired my first associate. And I was a terrible leader.
And it wasn't your wife?
Was not my wife. So when I started the first practice, Molly, who's a dentist, as you alluded to also, was working for a corporation to basically pay the bills while I was, like I said, working 7 to 7, working at this other practice to try and, pay for things. So I had that incredible support from her financially, as we weren't making any money when we started the first practice. So after that practice got going, before we started her practice, because the original plan was to just have 2 practices, until we realized that we couldn't vacation together if we had 2 practices, because we couldn't close them both.
No problem.
Back to lifestyle design, we realized all these mistakes that we were making. So we're like, well, we have to have associates at the 2 practices so that we can vacation together to keep the practice open, see the emergencies, and keep things going. So as I brought on the first associate, I didn't really understand the concept that I needed to feed the associate before I fed myself. So, we were doing pretty good at the practice. We were seeing, at this time, I think we were probably seeing about 50 new patients a month. So we had enough patients to divide the new patients. But in order for that doctor to be successful, I needed to take a bit of a revenue cut to make sure that they were meeting their numbers to keep them happy. Well, I didn't realize that at first. So I wasn't giving them crowns and flipping them the treatment, because I had already built, it was my patients and I built this. And that was kind of the beginning of the transition in my mindset to how can I help and grow others? And it took a huge failure. I was thinking I was doing a really good job, took that doctor out to dinner at his 1 year. And I said, things seem to be going really good. Like, we've had bumps in the road, and, I'm really excited about your production level and your income, and your leadership's getting really good. He says, well, thanks, doc. I think I'm going to not renew my contract, and it's done tomorrow. And I was like, done tomorrow? We have patients that you're going to see. Like, I have no idea. I have no idea what's going on. Like, this is crazy. Like, have you read the contract? It doesn't say you just leave tomorrow. Like, you got to give me like a month to find a new. I can't see all these patients. I can't work, 10 days a week. I only have 7 days to work. And so that was a real slap in the face in communication, because, as you said, I was a good communicator. At that time, I wasn't a good communicator. I was the type of leader in my mind that was like, look at me and look how hard I'm working, and you should work hard too. And I'm working so hard for you. And that's not a leader. A leader has to ask and communicate. So I built systems in my life so that we can have check-ins with associates and try and feel where they're at and communicate more, so that never happens to me again. And then as we grew, we realized that it got more fun to grow the team and build the business systems and learn about new technologies and new things that are out there in dentistry than it was for me to do clinical dentistry. So eventually it meant that I needed to move on. But the reason why I moved from clinical dentistry really is there were other problems. I couldn't handle the business. When I was working full-time as a dentist and had 5 associates, there were more things that needed to happen.
How many offices?
I needed to move away.
That was how many offices?
So let me think.
3?
So I had 3 associates working and myself at the first practice. And Molly was working at her practice that she started with 2 associates. And then we'd started another practice. So we had, so at that time, I think we had 4 or 5, at least 4 or 5, 6 associates, and there was just more that needed to be done. So it was just, I was like, I don't have enough hours in the day to be doing dentistry and then be doing all the other business things that I needed to be doing. And furthermore, then I cut back from doing dentistry full time, and I was just getting in the way because the patients wanted to see Dr. Matt. And then I was only seeing patients 2 or 3 days a week. And so, because I'm only 2 or 3 days a week, they can't schedule the patients into my schedule. It's not fair to the other associates. So it just, I could see the writing on the wall that I just need to pull the plug to help everybody so that we could have some consistency in the practice. And it was better for me to get out of the way and let those great doctors that I hired do all the dentistry.
Mm-hmm. Was your ego a little bit shocked?
Tattered. It was incredibly hard. You've spent your whole life to try to become a dentist, and now you know that people like me of 10 years ago are going to be like, well, he thinks he's a dentist, but he's not. He doesn't practice.
Mm-hmm. Mm-hmm. He doesn't know. He's not a real dentist.
He doesn't even know how to place an implant. He's probably never even done a bone graft. So things, my ego was tattered. But I'm not better now that I'm not doing dentistry. It's just different. It's a part of my journey that's just different. It's the different season of my life. So I need to keep telling myself that, encouraging myself that it's okay. I don't need to, I spend a lot of energy worrying about what other people think of me in my past life. And, I just need to focus on other things than that. You know, there are going to be people that judge me because I don't do dentistry and think that I'm not connected. But my job is to try and stay connected.
Can we talk about the product that you invented? And you had, last time we talked about the product itself. It was awesome. But what's fascinating is when I got the package, the actual package from you, I couldn't control, like, if somebody from my team would have been next to me, I would be like, this is ridiculous. Like, you got to see it. Because I get packages, I look at packages, and especially during COVID, I had few doctors reach out and they say, we invented this thing and I want to build it. I want to see what to do with it and this and that, and yada, yada, yada. You're like, hey, I built this product. I'm going to send you a sample. I'm like, cool. You're like, what's your address? And I think I dropped the ball. I didn't send you my address. And then you're like, you by yourself, you're like, yo, where's your address? I'm like, that's my address. And then 2 days after, I get the package. I wish I would have it next to me, but a box. And I showed it last time. A box, a nice paper inside, the tube, the connector, and everything, and a nice plastic thing, not like cut out or anything. It just like you thought through details, right? And so out of that example, I have a bunch of questions. Meaning, how do you, like, did you even think about it? Like, did you sit down and like, hey, Molly, like over wine, you're like, I think I'm going to invent this thing. Or did you like, I think I'm going to build a business out of it? Like, just what are your initial, from a thought to like a product?
So like I believe all good businesses come about, they come about because of a problem. The first practice I started because there wasn't a practice that I wanted to work in. If there was, and somebody offered me an associate job and they was going to have some kind of ownership, then I would have been all in. So in this case, my team, when COVID came out, the biggest challenge was getting my team and the hygienists specifically to come back to work because they were scared naturally. There was a new novel virus that nobody knew anything about, and they were working in somebody's mouth and they were going to be spraying aerosol and ultrasonics. So I thought subjectively, like, what is the one thing that we may already have that helps to reduce aerosols? Because that was the biggest problem. And that was one of these, either a ISO-Lite or ISO-Dry mouthpiece, because it goes right to the source of where somebody is breathing out, and that's where the virus would come from. And it creates suction in their mouth to decrease the aerosol. So I was like, well, we don't have very many of those. They were all back ordered. I couldn't get them anywhere. So I said, how can I make these? And how can I make them for less? So originally I just called up I asked tons of people. I had the guy working on my house, and I asked him if he knew anybody that worked in a machine shop that could like make something that would fit one of these already made ISO-Lites or ISO-Dries. And so he found somebody, and he had a price, and it was pretty expensive, but it was less than it was going to be to buy the factory system. And then I ran into one of my engineering friends, one of my longest college friends, and I said, hey, Jason, do you think you can help make these? And he said, sure. So we got the price down to where it needed to be, but we had to order 200 of them. And I didn't need 200 of them. I needed like 5 per practice. So I needed like 20, 30 at the most. So I said, well, let's order 200 of them. Let's reach out to my friend network and see if they need them. So I text everybody I knew, and I asked them if they needed these things. And, I found they were sold pretty fast because everybody was scared and looking for something. So I sold 200 of them at just cost. And I started to think, well, maybe there's more people that need this. So I reached out to my friends that had group practices, and they were like, oh, Matt, if you can make these, I want them. So then I already sold 200 of them. So then I was like, well, I'm going to make it worth my time and my engineering friends' time, because we're actually spending a lot of time to put these together and do it. So I'll make it worth it. So I increased the price a little bit, and I was like, how do I accept payments? Like, I don't know how to do this. So I had to figure out how to set up a Shopify account and be able to collect tax and figure out how to ship them. And I was like, then I like opened up my eyes and I was like, oh, I have a business. Like this is a business. Like, what if I actually advertised or put a post on Facebook? And then I started selling more and more. So the company came out of just a pure necessity to fill my own needs. And then I realized that there was something that other people would want. And now the business is growing into a few other things that I'm excited about too.
So I hope you're going to launch that product we talked about.
Yeah, I will for sure. I will.
I have a feeling you will. That would be awesome. Man, there's like, I don't know. You know how many people walk around? Like, I remember saying, like, the greatest place of a lot of inventions is a graveyard, like some sort of like that, right? Like, there's so many things that people have in their heads just have not been built. And I'm curious, like, how do we push that forward? Like, how do we help people? Like, all it took you ask a couple people and ask your friend, and then we have a product. Like, imagine if dental assistants, hygienists, and the doctors have access to, like, implementing their ideas. And yeah, I get it. Like, 10 ideas would be bad, and 11th idea would be good, right? Just like, imagine how many products, new inventions we could have, like, going into the dentistry in the next 2 to 3 years.
Well, I think the biggest challenge that people have is they're looking for a novel invention, and a lot of times it's just making something better, making something easier, or making something cheaper, and trying to figure out what the consumer wants. And it's not necessary. It's usually right under your nose. It's something that somebody has already made, but they didn't put their whole heart and soul into it. And they didn't really think about it. They didn't think about the packaging like you talked about. They didn't think about how the consumer uses it. And they didn't listen to the problems that people are having. And that's what we're trying to do, is listen to how we can make our product better. And we've already gotten a ton of feedback, and we're making our own mouthpiece now. So we'll have our own standalone system, so we don't have to use another company's for our system. But we just listen to what people think doesn't work. And the ideas are out there. They don't have to come from you.
I think that's a lot of people that's what they're trying to chase. Was there anybody along the way that said, Matt, are you kidding me? Like, it's the dumbest thing I've ever heard.
I mean, that's just you're gonna have to insulate yourself from that in life. Like, I mean, going back to the first practice, I had one guy that called me and said, hey, another dentist, I heard you're putting a practice here. That will never work. There's been 4 failed restaurants there. There's no way it'll work. And one time I remember I sat this old guy down in the chair, and he told me, he said, I'm excited to meet you. And I was like, oh, good. Why are you excited to meet me? And he goes, I want to meet the courageous person that decided to go into this space, because this space has failed so many times that I want to see the person that thinks he's going to make this business work here. And I was like, really? Like, everything in my mind aligned that this was the perfect location. And it ended up being not the perfect location for a restaurant, but it was a perfect location for a dental practice. It had parking. It was on a super busy cross street with the stoplight in front of it. It was a standalone building. It wasn't in like a restaurant center, so there wasn't a lot of clutter around. And in my experience in life, there's always going to be people that are saying those things, but those people aren't on the field. They're not playing the game. They're on the sidelines, and they're around telling people it's not going to work. You just got to filter. You got to filter out that noise.
Well, the best thing I think I've heard, and for myself too, is like, the more I hear like this is the dumbest thing, the more I know that I'm onto something.
I love that. I'm going to take that home.
To me, that's the leverage that I'm like, if too many people like, I don't know, I'm like, I haven't done my homework. Or like, if too many people are like, oh, that's amazing. I'm like, when I start hearing that's the dumbest thing I've ever heard, I'm like, let's go.
Love it. Yeah. Yeah. If anything from this conversation, that's going to be the thing that I take away and think about. You're right. You're right.
Yeah. I really hope, I don't know how, like, that's where I'm trying to change the way we position Zen is like, it breaks my heart that you had to go on Shopify. Imagine if like everybody, like, imagine, forget about it. Imagine you invented the product and you're like, the first place I'm going is Zen's place. With the same experience, like setting up the shop and all of that, it just breaks my heart that we're not there yet.
Oh, you'll be there. You'll be there. There's in my life, I always tell myself that like the number one thing that I tell myself and my team is there's no unrealistic expectations, just timelines. And like one of our core values, Tiger, is to joyify the journey so that you're enjoying where you're at right now and not measuring forward and saying everything's going to be better when I get there. Because it's all about the journey. It's all about the process. And you'll get there, but you'll have another challenge when you get there. That's the interesting thing about life.
Probably suitable for that timing, not this timing.
Yeah, you're there. You're there. That's part of being a visionary. You're there in your mind, and disappointed that you're not there. But measure to where you've been. Measure before you even started the platform. Like what you're doing is amazing, in my opinion.
Thank you, Matt. Can we briefly talk about being a father?
Sure.
Like you're a dentist, you're a business owner, you're an inventor. I hope you're gonna have a patent soon, and it's like, and now you're father of two, and how is it? Like, did you take the paternity leave? How are you managing your time?
Oh, like everything else, I'm just meshing it all together. So the most of my time, I'm working from home right now, through Zoom. So all my leadership meetings are on Zoom. Tonight we call it the One Timber meeting. It's a town hall meeting where I have 50 employees. We get them all together and we do a Zoom and we talk about how the practices are. We spend a lot of time talking about core values and our purpose. Timber Dental's purpose, is to, joyify other people's journeys and live our core values day in and day out. So I need to talk to the team about that a lot. So I'm able to do that due to COVID because of our technology now. So I get to be home. So after this, I'll be able to go up and, have lunch with my 3-month-old and my 22-month-old. And that's an experience that's really incredible. And my whole life right now is surrounded around, as I was telling you, around the potty. So I got a kid potty training. So there's a lot of celebrations that happen around going potty. A lot of cheers and flushing and high fives. Now elbows. Like my daughter loves to do elbow. She's like, elbow. I'll be like, high five. And she'll go, elbow. That's pretty cute.
Oh my God. Yeah. That's so cool. But as far as like the business, do you share with your doctors about like being a father and the struggles and challenges? And
yeah, absolutely. I have another doctor that just had a daughter. She just turned 1, and it's a part of life that is one of those enriching experiences that you don't know that you need until you're in it. And having one kid was a piece of cake. If you're a business owner and you have one kid, it's easy. Two, I had no idea. I never thought I would be here saying how much more challenging 2 kids are than 1. Because
Wait till you have a third one. You'll be like, choose
oh
a
man, I
piece of
can't
cake.
imagine. I have so much respect and understanding for single parents and parents in general, and my parents. Like, relationship between a child and a parent grows when the child knows what it's like to be a parent.
Yeah.
Oh,
That's
yeah.
so awesome. Cool. Matt, what's next in the pipeline? What are you going to invent?
What am I going to invent? Well, do you want to look at the first product?
Yeah.
Okay, so the first product is my auto. There we go. The first, I got one of those stand up tables. So I hit the button over here. It wasn't on lock. That's what you get from working at home and having back injury. So the first thing is so we got gray hosing. What we had clear hosing originally, and it just gets grimy. So this whole unit can be sterilized, and what it does is you got your mouthpiece and you plug your mouthpiece into it. The company makes a version of this. This is much more flexible, can be sterilized, and obviously save you guys a bunch of money. It's really like a dental hack. And then this goes into the HVE. So you have your control here, and then you can use that. It's all sterilizable, all made in America. So that's a product to save you money, so you don't have to use the factory hosing. We got the same thing for Isolite. We got an adapter.
The Zyros product.
Yep. So goes on.
And for those who are listening right now, like it's going to be recorded as a podcast, I would highly recommend just go to, what is it going to be, like a minute 40 something, 50, and just look at the product itself. It's going to be on YouTube. I highly recommend. I mean, it's a really cool thing. So
that's the product. So you got a metal piece and then a rubber hosing that's all sterilizable. So the whole thing can go into your sterilizer, which sets it apart. It's super flexible, moves around. These come in different lengths depending on the different types of units. If you have rear delivery, you're going to want to get a 6-foot hose. If you have on the chair delivery, you're only going to need a 4-foot hose. The next product we're coming out with is we're making a mouthpiece to save you guys money on the mouthpiece that goes into the mouth. Fully standalone unit like the other ones. And then the other product that we're working on that we're really excited about is a HEPA filter with a cone on it, similar to what you guys have seen. We're going to make it quieter, smaller footprint. And just, I mean, our company's goal is to just make things less and better for the dentist. And that's just it.
What's the third product? Can we talk more about it?
Yeah. So I'm sure all your dentists are familiar with the aerosol reducing standalone units that have a HEPA filter in them. So they have a cone that goes next to the patient's mouth with a standalone suction that suctions through either a HEPA filter or UV light. And then they filter that back into the room. So it'll decrease aerosol, but it also filters the air. Some of these things that are coming about because of COVID, I don't think are going to go away. I compare it to way back when the AIDS epidemic came out. People weren't doing things like wearing masks and wearing gloves. And that's something that we consider just standard of care now. You would never operate without wearing gloves. And that's something that came about because of AIDS. Although COVID may go away at some point, I think we're still going to be concerned about aerosols, filtering our air, keeping things clean. This is going to be another layer of infection control. Dentists are already the best at infection control. We already know that no COVID outbreaks have come from a dental practice because our infection control is so great. But there's always room for improvement. And I think anytime we bring on something new like this, it's going to stick around. So we're trying to make a cheaper, better, quieter aerosol reduction in room aerosol reduction unit, then go right next to the patient and suction up any of that aerosol.
Not a $3,000 machine that stands in a
Yeah. We're talking about a unit that is like the size of a rolling suitcase or smaller, with a flexible arm on it that comes out, that not only filters the air, but filters that immediate air where there's aerosol next to the patient.
Mm-hmm. And I have a feeling you're not a big fan of putting like a shield or a box.
Patient experience is a number one, and perception to the patient is so important. Exactly. I cannot stand when I walk into an operatory in one of my friends' practice and it's covered in plastic. That does not make the patient feel more comfortable. It makes them feel scared. And then when they have all the instruments laid out already for the patient to see, we really got to think about how our fearful patient is perceiving the dental experience.
Yeah. When are you coming up with these two products?
So I would say they'll probably be out in no later than 6 months. The mouthpiece is going to be out sooner than that. We're getting that prototype right now. So we should have the prototype out in a couple of weeks, but then we got to test it.
That's awesome.
Genuinely, I'm learning how to do this as we building the plane as we fly it. I've never done.
Part of me is like want to get on the plane, get to Portland to work with you on these things.
Yeah,
man, this is so cool. Like, I love that.
Fun stuff. Yeah, thanks for your support on this, Tiger. I appreciate it.
Yeah, we would love to. Irina, let's make a note. When these products come out, can we talk about it on our Friday supply availability call, like for 10 minutes when we launch them? So Matt, we'll invite you sometime in October. Like, as long as you give us a heads up that you have the mouthpiece, we'll go with that first.
Love it. Cool.
Awesome. Thanks for sharing your story. I think it's really incredible, and I hope we challenge some people with their POVs on life in dentistry.
Yeah, there's a lot of opportunity out there, and my only advice is follow what you want to do. Build the practice that you believe in, the practice that you love, and build it for yourself. And things will happen, and be open to change. We don't know where life's going to go, and if you allow life to go where it wants to go, amazing things are going to happen.
Yeah. That's so cool. Thanks, Matt. Love your story, man. Yeah, I appreciate it.